Governor Christie was introduced at Integrity House in Newark as a champion for individuals struggling with addiction. Today, he said he wants to spend hundreds of millions to combat the opioid crisis in a new way.
We always say we do not have a treatment bed problem in New Jersey. We have a relapse problem in New Jersey. And if we dealt with the relapse problem, we would not nearly have a treatment bed problem that we have today.
With more programs and more dollars, the governor hopes to bridge gaps in the support system for those in recovery, and includes $36 million for housing and support for addicts, $35 million for opioid-addicted mothers and their babies. $21 million will help expand the Recovery Coach program for recent overdose survivors. So where will the money come from? Christie is taking it from the budgets of other state departments, but no specific details were given.
What I can tell you is there'll be no vital program that's cut, and there will be no tax that will be increased to do this.
Why are the New Jersey taxpayers having to foot up $200 million out of a starved cow of a state budget that was passed in July when the federal money is available to do this? And he's the federal opiate czar. He just doesn't have the nerve to go against Donald Trump.
In January, Christie declared the heroin and opioid epidemic a public health emergency, but the president still has not. In 2016, 64,000 people died of an overdose nationally. One
of the things that we fought for in the budget was the ability for the governor to be able to move money from any line item in the state budget to address a public health crisis.
Governor Christie says the funds will be distributed immediately to start these programs up before he leaves office in January. In Newark, Meg Baker, CBS 2 News.
Christie says he hopes New Jersey's plan will become a national model. He does chair President Trump's Opioid Commission and expects its final report to be issued in the coming months.